Hi guys, my name is Luca. I'm the co-founder and CEO of Index Health, and I'm here with my co-founder Chris.
Hey, good morning, everybody. Dr. Chris LeMay. I'm excited to take part in an Ask Me Anything session today, where Luke will be posing some questions. And the specifics of the topic we're talking about today is actually related to some prevention topics. So I'm excited to go through it with you.
Sounds good. And these questions are coming from our patients, as well as people who just write to us. So these are questions that you can also submit towards the end. You can also submit on the Google Sheets form and ask any question that we'll address next time around. So as Dr. Chris mentioned, we'll be speaking about prevention. And so I'll start off with kind of a general one that kind of a reoccurring question, which is, how can I find out what disease I'm susceptible to in the coming years?
Sure, it's a great question, such an important one. We're at an exciting point in medicine where we've got so much information and so much data coming in that really ties into specific disease risks. And so, I think the top priority for individuals is, number one, to get with a physician or a team that's able to help them understand where they're at from a risk standpoint, first and foremost. But obviously, that's not the gold star. What
Sure.
Really the gold star here is we want to be able to help people not just understand where they're at, but obviously also how to decrease those risks. So it's a very exciting time in medicine.
Can you give me an example of what would you do, if I'm coming in and I have a history of, let's say, Alzheimer's or some sort of dementia, what's the process for you guys to figure out, yes, this is a risk, and here's what to do about it?
Sure. Yeah. So, we'll specifically, speak to that. Obviously, Dr. Bredesen's research is incredibly compelling and inspiring because, for that particular diagnosis of dementia and Alzheimer's type, previously, if you were given that diagnosis, unfortunately, it was one that was absent of any hope. Unfortunately, you were given a prescription. Prescriptions don't typically offer a lot of benefit for most people. And so it was unfortunately just a tragic, steady decline. What his research has offered us is really incredible insight to be able to understand, the at least 36 different underlying things that can, push an individual towards developing a dementia. And so the idea being, instead of this monotherapy, take one single prescription, and that it should, one prescription treats one disease. It's unfortunately, obviously, we've seen the results, and they're not good. And so he's identified at least 36 different things that we can focus on that are all contributors to eventually developing the disease. And so the idea is focusing on all those things, optimizing those things, and really rolling them back. And so
what would be an example of that? What are top three things? Would it be some sort of inflammation, toxicity? What is that? What should I be aware of as somebody who's susceptible to getting some sort of dementia?
Yeah, sure. It's great. So, one of the main things we see associated, well, first of all, he's identified 6 different subtypes. One of those subtypes, as you alluded to, is related to toxicity. Some people deal with mold exposures that they were never aware of. Some people are dealing with chronic infections that have never been treated. Certainly, insulin sensitivity or insulin resistance in this case is a big factor in this, because obviously we need that insulin responsiveness for all of our organs and our tissues to really operate in an optimal fashion. And sure, inflammation is a key element to that as well. And I would also mention a fourth one, which is common that we see is what's called trophic type of things. It's just basically related to hormones and insufficiency of hormones or suboptimal status of hormones can also contribute.
So basically, if I have diabetes type 2, then which is I'm insulin resistant, right? And then I have other problems with inflammation as well, which is usually common with diabetics, right? So does that immediately increase my chance of having dementia, or even being overweight for that matter?
Yeah, well, it is quite complicated, of course. Again, at least 36, but no doubt that's part of the puzzle. And if you were somebody who was starting to develop some cognitive symptoms, or if you were just somebody that said, listen, I have a family history and I really want to plan for this, what should I be looking at? No doubt, if you already have developed insulin resistance, we've got, you know, a source of inflammation, abnormal inflammation. Those would want to be, you know, those would be top priorities for you to really improve.
Yeah, understood. Okay.
Yeah.
And can you elaborate a bit more on what does exactly inflammation mean? I know it's a common
Sure.
question that, yeah, sure.
Yeah, so inflammation, of course, comes from a variety of different sources. You know, chronic infections, obviously, you know, I mentioned previously, that would be one of them. We see a lot of people who have gut health issues. And so
Yeah.
those gut health issues, you know, whether it's what's called dysbiosis or kind of abnormal, you know, neighbors in the neighborhood you don't particularly want, you know, addressing those, often we see with inflammatory markers that we typically look at will actually improve, you know. So it's kind of like it's kind of like an investigator or, you know, a detective in a lot of ways, the way we operate within functional medicine, you know, because once we identify that somebody does in fact have you know, significantly elevated inflammatory markers, that's kind of when the work starts, right? Because we need to figure out the why part of it. You know, again, I mentioned mold, I mentioned infections, I mentioned, you know, gut issues. And so
Sure.
it's really digging in, finding, you know, figuring out the root cause or root causes, addressing those things. And then, you know, it's always exciting and a lot of fun to see the inflammatory markers come down as we resolve those things.
So since we're speaking about prevention and all, how does food impact my ability to prevent a certain disease?
Sure. I mean, food is
Is it a
integral.
common question here?
Yeah, sure. You know, it's it arguably is the most important part of the puzzle. I would
Sure.
say it is, right, because you know, food is medicine, right? You know, in the sense of we have so many members who, you know, were on medications. They get on a proper nutrition plan and they find that they're able to decrease substantially or even discontinue their medications. So food is medicine, no doubt. Food is information, right? Food is, you know, the nutrients, the vital nutrients that were provided from food are, you know, obviously involved in the countless different enzymatic reactions that our body carries out, you know, to really
Sure.
maintain an optimal health status. So yeah, our team at Index, of course, you know, our certified nutrition specialist, you know, is really master's level training, and they're just incredible at what they do. And they are again, arguably the most important part of the team, because getting that person a proper nutrition plan that suits them well, it really pays just enormous dividends. It doesn't happen at the snap of a finger, of course, but absolutely over time, incredibly vital.
Sure.
Yeah.
And so speaking of food, which often relates to, you know, heart health, and which is, if not the most common disease, heart disease in America, how does that tie in with, you know, the differences between, you know, somebody who may get, or essentially when looking at it from a prevention perspective, if I want to prevent, you know, getting dementia, am I also preventing heart disease in the meantime, or, you know, how do the two things tie in essentially?
Sure. Yeah, there's definitely huge overlaps between the two conditions, in the sense of, sure, you look at, you know, insulin resistance aspect of things, which we discussed, clearly is part of the development process of you know, how somebody, or what's involved when somebody starts to develop a blockage in an artery, whether it be the heart or you know, brain
Sure.
artery as well. The other aspects we look at, perhaps a little bit more heavily, a little bit more of a priority when you're talking about heart health versus brain health, is going to be the lipid markers. Unfortunately, when people go for their annual physical examinations, they typically will involve a basic lipid panel, which when I was in medical school, they told us we need to know total cholesterol and we need to know LDL. And so with that understanding, as I was an emergency physician for 13 years, and we would have patients come in who were having heart attacks, active
Sure.
blockages of the arteries. And I was always interested to follow their hospital course and see, and part of that hospital course would involve doing a basic lipid panel. And I would see time and time again, this was so confusing to me, that people would have a quote unquote normal lipid panel. And
Wow.
yeah, so what we see, which obviously clearly doesn't compute with what I was taught in medical school. And fast forward now, we've got so much abundance of data that has shown us that the statistic actually is mind-boggling. That 50% of people who have blockages of arteries or heart attacks or strokes have normal lipid panels. So obviously, it doesn't tell the whole story. So when we're talking about
but that's crazy. But why is that? So if I'm going to the doctor getting my yearly and the doctor's saying everything's all right, and then I come up with a heart attack in in a month from now, why is that?
Yeah, it's unfortunate, but the unfortunate truth, and it just speaks to sort of making sure that an individual has that proper understanding of their risk, and that understanding of that risk is rooted in the right information, right? That's so important. And so what we've come to realize now through more recent evidence and publications is that you really ought to be looking in a lot more detail related to the lipid parameters, specifically a lot of the things that we look at related to what type of LDL molecules are present or particles are present. Are they the tiny ones? Are they the dense ones? Are they the oxidized ones? Are they the ones that basically are going to start, that are high risk to start the process of developing that plaque in the artery? So I just I always feel so unfortunate on behalf of the individuals we take care of when again, if they've had a history of heart disease, but nobody's ever looked at this because unfortunately it's just an incomplete picture is really what it ends up being.
And so what foods should I be, maybe top 3 foods I should be avoiding, and maybe top 3 that I should always be eating to have a healthy heart?
Yeah, so quite honestly, that looks completely different for everybody, and some of that is rooted in genomics. Some of that is rooted in their current comorbidities. Their current coexisting diagnoses. Obviously, diabetes. You're going to want to plan a bit different. I think I would summarize as a whole, just kind of as an overarching theme. If you have heart disease, certainly you're going to want to be prioritizing an anti-inflammatory diet. That's clear. And you're also going to, not to dive into too much detail related to that, but there are foods that are known to be more inflammatory in nature, right? They just think about like, fried foods or fast foods or, kind of ultra processed
the
foods.
Guilty pleasures. Yeah.
The stuff that, is for some people just love it. Obviously the taste, they make it that way on purpose, so, but sure, the things that, I think we all kind of know, maybe this isn't the best thing for me, but wow, it's really delicious. And obviously in somebody who's got heart disease or is at high risk for heart disease, it becomes obviously more of a priority and more of a, maybe stay away, or if you eat it, it's got to be quite infrequent. And then if you shift towards the to-dos, you're really going to look at phytonutrient dense foods. So eating the colors of the rainbow is so important. Consuming fiber is so important. Obviously, that tends to come from fruits and vegetables. And we as a nation in America are incredibly deficient in fiber. The average, the statistic I've seen is average consumption of fiber in American is around 13 grams total, which is incredibly low. We aim for 30, sometimes even 50. So fiber and colors and and really high quality fats and oils is another priority as well. So again, the more we think about more omega-3s and versus omega-6s, anti-inflammatory versus inflammatory. So obviously it's difficult to make that top 3 list of each one, but I think if we could summarize it, it would probably look something along those lines. But again, it looks different for everybody.
Sure. And second to last question, if I'm going to a wedding, I'm going to a birthday party, something like that, I have a bit of cake, I have a pizza and stuff like that, how bad is that in reality, and how can I balance that out?
Yeah, listen, I don't think in functional medicine our goal isn't necessarily this massive overhaul. We want to meet people where they're at and encourage them and give them that right information and kind of nudge them. So this this is a constantly ongoing process. And so, I'll just use kind of an extreme example. If you're somebody who eats fast food, three, 4, 5 times a week, and somebody tells you, hey, you need to go, organic, paleo or vegan or something like that.
Everything.
You're going to fail, right? The failure rate, and people get frustrated, and they get, it's just, they drop out, and then, they don't make the progress that, we're really hoping for. And so the idea is not this, you're here and now we want to go way over here, but rather it's, okay, this is where we're starting. Let's inch towards some progress. Let's grow our understanding, So you're gonna have some pizza every now and again. You're gonna have some cake every now and again, assuming you don't have any, serious gluten allergies or issues or celiac or anything along those lines. You got to live your life and enjoy your life. I think it's important, but certainly nudging, towards continual growth of optimization of health is, that's what we do. So.
Sure. And the last question, kind of a fast shooting one, is what are 2 or 3 books that you'd recommend for, prevention and longevity?
Sure. Dale Bredesen's most recent book that just came out actually last month, it's called The First Survivors of Alzheimer's. Incredibly impactful, because it's written by patients of his who had been diagnosed with cognitive decline. Their brain health was pushing towards dementia, Alzheimer's type. And to have them go through his protocol and improve their cognition is unheard of. First of all, let's just start there. It's absolutely unheard of. But to have them writing about their experience of going through it and what their life looks like now, and how hope has been restored, incredible, absolutely incredible.
Sure.
I also love Dr. Mark Hyman's book, Food, What the Heck Should I Eat? Because it gives people, an approachable description of, exactly that. What the heck should I be eating? Kind of what you talked about. So it really is. So those 2 certainly are towards the top. And there's also another book called The Blue Zones, which kind of just gives
the
blue zones. The blue zones. Okay. Yeah. So it gives basically a description of the groups of people who have had a history of the greatest longevity, basically, and kind of gives some characteristics of some of the things that that are involved in their lifestyle elements.
Wow, I never heard of that book actually.
Yeah.
The first 2 I'm familiar with, definitely, but the third one, that's actually very, very interesting.
Yeah.
Sure.
Yeah. And actually, sorry, I lied. I got one more for you, which is
go for it.
Which a book called The Body Keeps Score, which is a very, very important book, because it relates to our mental health, traumatic events that may have occurred throughout our lives and in childhood specifically, and how that can impact our health long term. And so it gives really insight into how you can address these things. There's something called adverse childhood events score. And so if you've got an elevated adverse childhood event score, there's clear indications that ties to certain long-term health outcomes and certain mental health complications, or I should say, comorbidities. And so it just really highlights the need for people who have had that to really make it a focus and a priority as part of more of a obviously an entire comprehensive plan. That's the nutrition and and the lifestyle elements, but focusing on that for some people is really key to actually unlocking the progress related to their long-term health outcomes.
Yeah, perfect. Thanks a lot, Dr. Chris, for the asking me anything. We'll see what our patients ask next time, and then we'll cover those topics as well. So thanks for listening, guys.